Hello everyone, in this video I will give you an introductory lecture to the journal Pharmacology. First of all, talking about pharmacology itself. Pharmacology is the study of drugs. It is a very vast term under which various subheadings are studied. In this video I will tell you about what does pharmacokinetic means, what does pharmacodynamic means. I will tell you about some routes of administration of drugs. I will tell you what is bioavailability. I will tell you about drug distribution, and I will tell you about the elimination of the drugs from our body. Okay, now first of all, talking about the pharmacokinetics. Pharmacokinetics, under this heading, we study what does the body does to the drug. It is basically the study of absorption, distribution, metabolism, and elimination of the drug. When drug enters our body, what are the responses of our body to our drug? These responses are studied under the term of the pharmacokinetics. While talking about the term pharmacodynamics means what does the drug does to the body, what are the various effects of the drugs, how does it act, and what is its mechanism of action. Okay, now first of all, talking about pharmacokinetics, I have told you it is the study of absorption, distribution, metabolism, and elimination of drug. First of all, I will talk about the routes of administration of the drugs. There are the routes of administration of drugs are basically divided into two types: the enteral and the parenteral. The enteral drugs is the administration of drugs by mouth. It is either oral or the sublingual, and the parenteral are introduction of the drugs directly into our systemic circulation. The parenteral route consists of the intravenous route, which is the administration of drugs in the vein, intramuscular, the introduction of drugs in the muscles, and the subcutaneous, introduction of drugs in through our skin. There are also some other routes of administration, which are the oral inhalation, nasal inhalation, topical, transdermal, or through the rectal routes. These were the routes of administration of drugs into our body. Okay, now first of all, talking about the absorption of drug. What does absorption of drug means? Absorption of a drug, absorption is the transfer of a drug from a site of administration to the bloodstream. I have told you all the sites: the oral, sublingual, intravenous, and the subcutaneous. And from the traveling of drug from its routes of administration or the site of administration to the bloodstream or the circulation, it is known as the absorption of the drug. Okay, now talking about how does our blood gets absorbed from any route into our bloodstream. There are different mechanism of absorption of drugs from our body. When we first of all, I will talk about the oral route. If we take any drug from the oral route, it goes into our GIT. From GIT, the drug can be absorbed by the passive diffusion, or either by facilitated diffusion, by active transport, or by endocytosis or the exocytosis. Now there are some factors which affect the absorption of the drugs. These are the blood flow to the absorption site, total surface area for absorption, or the contact time at the absorption surface. These I have told you the mechanism of absorption, which were the passive diffusion, facilitated diffusion, and there are some factors affecting the absorption, which were blood flow to the absorption site, total surface area available for absorption, and the contact time at the surface. Okay, now I will talk about the drug distribution. What does the drug distribution means? Talking about the definition, drug distribution means it is a process by which a drug reversibly leaves the bloodstream and enters the interstitium and the tissues. Okay, further explaining this definition, when the drug enters the body, it is absorbed into the blood, and from blood it is further absorbed into the interstitium and the tissues, at which is the baseline of the effect of the drugs. There are also some factors affecting the drug distribution, which are the blood flow to the absorption site, capillary permeability, and the binding of drugs to the proteins. These are the important factors which affect the drug distribution into our body. Okay, I will now talk about the clearance of drugs or the elimination of drugs. Every drug which enters our body must be eliminated. There are several routes of drug clearance or elimination of drugs. The most common and the most important are the hepatic, through elimination of drug through the hepatic metabolism, or biliary elimination, urinary elimination, and the most important is the renal elimination. I will talk about the renal elimination of a drug. We know that various processes are going in our kidney. Along with this, the drug can also be filtered. The three processes in the kidney or the nephron which are going on, which are the glomerular filtration, the proximal tubular secretion, and the distal tubular reabsorption. These three steps are the same for the urine formation, and through these three same steps, drugs can also be eliminated from the body. Okay, now talking about the bioavailability, it is another term which we study under the heading of general pharmacology. Bioavailability is the rate and extent to which an administered drug reaches the systemic circulation. What does it mean? It means that if we take 100 milligram of a drug through the oral route, and from the GIT it reaches our systemic circulation or our blood circulation. Through all these processes, some of the amount of the drug gets absorbed. Some is absorbed in the saliva and mouth, some through the esophagus, some in the stomach before reaching the blood or the systemic circulation. So if we assume that we take 100 milligram of drug and the 70 milligram of drug reaches our systemic circulation, we can say that this drug bioavailability is 70%, or the 70% of the administered drug reaches our systemic circulation, through which further effect can take place. Okay, now summarizing all the points I have told you. First of all, I have told you about the basic definition of the pharmacology, which is the study of drugs. Then I have told you the two major terms studied in the general pharmacology, which are the pharmacokinetics and the pharmacodynamics. The basic point to memorize or to differentiate these two headings are: pharmacokinetics means what the body does to the drug. The body absorbs the drug, distributes it, break down it, and eliminates it from the body. These headings are studied under the umbrella of the pharmacokinetics. The second one was the pharmacodynamics. Pharmacodynamic means what does the drug does to the body, how does the drug affects our body, and what are its various mechanism of action. Then I told you about the routes of administration, which are the enteral and the parenteral. Enteral means administration of drug through the mouth, which includes the oral and the sublingual routes, and there is parenteral route. Talking about the parenteral route, it has the highest bioavailability because the drug directly reaches the systemic circulation. Three main route of administration included under the parenteral route is the intravenous, the intramuscular, and the subcutaneous. There are also other routes of administration, which are the oral inhalation, nasal inhalation, and through rectal. Then I have told you about the absorption of drug, the mechanism of absorption of drugs, factors influencing absorption. Then I have told you about the drug distribution, about the clearance of the drugs, how does the blood drugs are cleared from the body. The most important clearance route was through the kidneys. And in the end, I have told you about the bioavailability, which means the extent to which administered drug reaches the systemic circulation. And I have given you example of 100 milligram drug and 70 milligram of it reaches the circulation. So we can say that this drug has 70% of the bioavailability. I hope you got a better understanding of these basic terms studied under the general pharmacology. If you have any query, you can ask me in the comment section. If you liked my video, give it a thumbs up and subscribe to my channel. Thank you for watching.